evening. My name is Jim McGuire. Welcome to our show tonight from the Carmel Studios, Comcast Studios in Carmel. Tonight we have a very important show. We're going to be talking about prescription drugs and heroin addiction. This is a major problem in Putnam County and the surrounding counties. We have a great panel tonight who are going to talk about this. But first, I just want to say a couple of things about this. I just saw recently on channel, I think it was Channel 12, Westchester News, that something like 38 people have died from overdose of heroin in the last year. And in Poughkeepsie, New York, something like 68 people have died. So it just shows you how serious this problem is. And then that famous actor in New York City who passed away from heroin, it just shows you it can affect the very renowned and famous and also the ordinary guy or girl working for a living. Once you dabble with this type of drug, you really go down a sliding hill, and it's very difficult to deal with. But that's what our show is about tonight. It's about recovery and trying to find a way back, okay? So I just want to mention who the panel is here tonight, and they can introduce themselves. Tonight we have with us Stephen and Susan Salomone, who started a wonderful organization called Drug Crisis in Our Backyard, and they'll talk about that tonight and how it's going to help families and people. And also we have with us tonight from Phoenix House, Dr. Stephen Margolies, and he's here from Long Island to talk about, from Phoenix House, to talk about drug treatment and what's going on in Phoenix House and why we have such trouble today with these drugs, heroin and that. So thank you for coming. Thank you very much.
Thank you,
Thanks
Jim.
for having us, Jim.
Susan and Steve, could you just introduce yourself, say a little bit about the organization you have? We'll start with Stephen. And, you know, why is it so important, this topic? Steve?
Well, we started an organization called Drug Crisis in Our Backyard. Our primary mission is to drive awareness, create awareness in the community about the rampant use of drugs and what it's doing to our young people and our quality of life. The reason we were motivated to do that was we lost our son Justin on May 29th, 2012 to an overdose. It was his second heroin overdose. He sustained a brain damage after his first, and then his second was fatal. So Susan, why don't you talk about the open letter that you wrote and the reaction from the community which led to the drug crisis?
Okay, after we lost our son in May of 2012, I wrote a letter to the Mahopac News telling our story about what we had gone through with Justin, which was a long period of addiction and finally a brain injury and death. And I got a call from Lou Christensen the day our newspaper came out, and he said that he buried his son that morning, his 28-year-old son, and our son was 29. And we got together and we said we were not just going to sit back and act like our sons died of whatever, a heart attack or whatever we could make up. We were going to come out, we were going to tell everyone exactly what our sons died of and let them know that this was happening in our community and the struggle that we had with our children. And so we started Drug Crisis in Our Backyard, and we said that we were going to do forums around the county and northern Westchester and Putnam County, and our forums would be educational. We'd have speakers. And so far we're coming up on our 6th forum, which we are co-sponsoring with Phoenix House, and Dr. Margolies was nice enough to take time out of his busy schedule today to come on and talk about what our forum is going to be like and other things about heroin and addiction today.
Thank you, Susan. Steve, Dr. Margolies, could you tell us a little bit about Phoenix House and yourself?
I'm Dr. Stephen Margolies, as I was introduced, and I am the Vice President of Clinical and Medical Services and Medical Director at Phoenix House. I've been there a little over 2 years. Phoenix House had started in the 60s, 1967 actually, as by a number of recovering heroin addicts that were looking for a place where they could actually be in recovery together. It started in a brownstone on West 85th Street, and has since then grown to be in 11 states with over 100 programs. We have 30 programs just in the New York region. Phoenix House traditionally started as traditional long-term care, which was a therapeutic community model, which meant that people would come there for 6 to 12 months, sometimes 2 years, and live there and change their lives. As time changed and evolved, and as addiction has changed, we've seen that there are other ways and other methodologies that are potentially even more effective. And we've also seen that addiction has been, the treatment of addiction is actually a medical treatment at this point, and it's the treatment of a disease. So we've Phoenix House has been evolving towards the medical treatment of addiction as well as the social treatment and the life-changing work that we've done.
I see. Thank you, Doctor.
Yeah.
Susan, could you tell us a little bit about the forum and what goes on there when you actually go to a place to talk?
Okay, what we'll do is, I think Steve will talk about the speakers that we're going to have at this forum,
Right.
and Dr. Margolies can help us with that because he knows one of the speakers.
Right.
And
Yeah, so we're having on March 13th, in just a few weeks, we're having a forum at the Phoenix House in Shrub Oak, and it's open to the public, and we welcome you to come. And we have lined up 3 really terrific speakers. The first one is Dr. Kolodny, the Chief Medical Officer at Phoenix House. We also have David Sheff, an author of a best-selling book, 2 best-selling books, and also Greg Williams, who is a film producer. And I'd like to have Dr. Margolies, why don't you talk about Dr. Kolodny and what he's going to bring to the forum.
Sure. Andrew Kolodny is our Chief Medical Officer overseeing our national clinical programming. He had come to Phoenix House and has also created an organization that addresses prescription opiate abuse and prescription opiate prescribing. It's called PROP, which is Physicians for Responsible Opiate Prescribing. He is going to talk about the extent and the changing face of the opiate epidemic in this country and has some very, very interesting information on how it evolved, where it's hitting the hardest, and how it's actually shifted to different populations in the United States. I think his presentation will actually open the eyes for a lot of people on the extent of the epidemic and what we're trying to achieve with it. And he'll also talk about treatment options and treatment regimens that can affect on the epidemic.
Our 2 other speakers are, first off, David Sheff. David Sheff is a best-selling author. He wrote 2 books. One is called Clean, and the other one is called A Beautiful Boy. He'll talk about the experiences that he had, and that's what his books are about, of the experience of having a son who was a heroin addict and how that affected his family. And I think the attendees from the forum are going to get a lot out of that, and a lot of insight as to what goes on inside the 4 walls of a home that's struggling with this problem. And then lastly, we have Greg Williams, who is a film producer that created a great film called Anonymous People. The film is about recovery. There are over 20 million people in this country that are in recovery successfully, and the film is about those people and thinking about marshaling them as a resource to help people deal with addiction in their own lives. So those are great speakers, and in addition to the forum, our attendees are parents that have or want to learn about addiction, as well as a lot of professionals that deal with the problem of addiction. Susan, if you want to talk a little bit about that in terms of what people experience when they come to the forum, that'd be great.
I just want to mention that David's son, Nick, he also wrote a book. It's called Tweak, and it is about his addiction. And it wasn't heroin that he was addicted to. He was addicted to methamphetamine. So it doesn't really matter. The fact of the matter is that he had this disease, and his family had gone through terrible things that families go through when their children are addicted to something. I think that the people that come to this forum are going to learn a lot. People that come to our forums always get a lot of information, and we have resource tables in the back of our facility where they can go and meet people that run treatment centers and get firsthand information on how to tackle this disease and create a plan for recovery for their loved ones, whether it be their husband, their children, or a sister, or whoever it is that they are concerned about.
Jim, if I could interrupt,
sure,
just on a slightly different note, going back to how this all started, one of the things that was very striking to Susan and I when we first had the experience of our son's death was when Susan wrote the letter, the open letter to the Mayapack News, we kind of went public with it, and we got an amazing wave of reaction from the community. And what we found was the problem was far more prevalent in our local community than we had ever imagined. And people were starved for help, and they were hiding this problem because they were embarrassed about it. And so coming out was difficult for them. But when we thought about looking at this as a disease, which it is, there was some comfort in that, and also some guidance in how to deal with it. And it's not a behavioral problem. It's a medical problem. It's a disease. So again, that was a lot of what we learned with the forum, but I think most shocking was how many people are troubled with this in our community.
Yeah. I just wondering, when you have a forum, do you have parents contacting you, calling you about their own children? Do you have that going on now?
Yes.
Yeah, they do
Yep.
call?
They call, and they go on our website to get my email address, and you know, they contact us. We have 400 people on our closed group on Facebook.
So they have a place to go now.
They have some place, yes.
Which is nice.
Yes.
I just want to ask all three of you, want to say, why do you think heroin is such an epidemic proportions today? Why is that happening? Is it a societal type of problem, Doc?
Actually, I could comment on that. I think what we've seen is a shift. I think when people in the past have talked about and thought about things like opiate and heroin addiction, they thought of it as an inner city injection drug using problem.
Inner city, yeah.
And what has happened in the past, since the 90s really, is we've seen this rise in people using prescription opiate medications, either medical misuse, abuse, or illegal use, same thing, where the medications have become more available for a variety of reasons. And also the step of taking a pill is a lot different than cooking up heroin and and injecting it. And what we're seeing is most of the people that are now being affected by the epidemic are no longer that inner city population. It's now a suburban, middle, and upper middle class problem, where we're seeing mostly younger people from these areas who have started with pills, either prescriptions or medications they bought. And as the medications go up in price, because some of the pills on the black market, on the illegal market, can be pretty expensive. You hear like OxyContin can be about $1 a milligram. The natural next step when you run out of money is to go to another opiate, and the other opiate that's available, that's cheap, is heroin. The other problem is that the prescription pills are very potent. So when people switch, and I hear this all the time from our patients, I couldn't get the pills anymore. I decided to buy, I got some heroin. They're going right to injecting it because they can't get the same feeling, or basically try not to get sick or go through withdrawal with the same amount of drugs unless they inject it. And what you're seeing is that you're seeing that group of people, and it's a combination. We see people, most of them are starting with prescriptions. There's a transition at some point to heroin, and some of them mix it, because essentially heroin and opiates are the same thing. Heroin is an opiate. It's an unstable opiate that's not great for medical treatment of much of anything, but it is an opiate. So the feeling that people get when they inject heroin is the same feeling they get when they start taking some of the prescription medications.
I see. Wow.
Interesting.
Do you want to say something, Susan, Stephen, about that, the epidemic of heroin?
Well, last night I went to see Chris Heron. He spoke at Lakeland High School, and he is a recovering heroin addict, and I believe he played for the Boston Celtics.
Yeah.
I believe that he said he had a $25,000 a month habit on OxyContin. That is a lot of money.
It's
Really a lot of money.
And you think they're going for $30 to $60 a pill.
Amazing.
Yeah.
The other thing, Jim, is
Yes,
that the opiates, medically they create this dependence very quickly, and I think a lot of people that are experimenting don't realize that they're going to be physically dependent on this drug, and that becomes kind of a black hole they fall into, and it really starts to change them. It changes the brain chemistry in addition, and the cravings just become so powerful they can't really stop. And so it's a very dangerous, high stakes game to experiment with these kinds of drugs.
Yeah, exactly. I just was saying that there isn't really casual use of these drugs. People have asked how long does it take to become addicted. It's hard to put a timeline on it, but any kind of misuse of these drugs is a real warning sign. And what you'll see, typically, people, as they start to develop a habit, are not taking the drug to get high anymore. They're taking the drug not to get sick, or they call it to feel right. And that increases and increases over time. So, the onset of this could be very insidious. It could look like nothing, and you may not see somebody actually physically looking high, and then they're really at some point just trying to get back to a normal state.
Doctor, I was wondering, I remember when I was a young kid growing up in the Bronx.
Me too.
Yeah. Oh, really?
Yeah.
What part of the Bronx?
Oh, Pelham Parkway.
Oh, very good. I came from Fordham Road.
Down the block.
Yeah. But anyways, I remember they used to say those when people use cocaine and heroin, it goes right to the brain, while alcohol goes all around in the bloodstream. Can you explain that a little bit, Doctor? Is that right? Or?
Any drug that has any kind of psychoactive effect is going right to the brain. I think what they mean is, some of it may be an urban myth, but when people inject heroin, they're actually getting a very large dose of drug that will cross into their brain and give them a very intense high. Stuff that people sniff, your nasal cavities have a lot of blood vessels. So when people sniff drugs, a lot of it gets absorbed very quickly. Alcohol goes through your GI tract, but alcohol does get absorbed quickly and still is also going to your brain. Right. So, some of it is, I'm assuming it's sort of an urban myth, but the truth is everything goes to your brain, just how quickly it gets there.
Right. I see what you mean. Yeah. I just want to ask this question for everybody on the panel. If you're a parent and you see a boy or girl in the family using drugs, is there any steps you could take to sort of stop it and to, make them wake up to what's going on? Anybody want to just say something? Susan?
Well, I've heard so much about this that I have very mixed feelings about it. If your child is young enough for you to get them right on the right track, if they're younger than 18, and you can demand that they do certain things, I would say go ahead and do it if you know they're using drugs. My son was 16 when he started using marijuana, and we brought him to a psychologist who said that he probably will not have a problem. He doesn't have a problem, he probably will not have a problem. Well, my thinking about that obviously is different now, because I think that if they're smoking pot, you've got to nip it in the bud, you've got to find out what's going on, because the chances of getting addicted at a young age like 16 are a lot higher than if he was 25 and smoking pot. So I think that it's really important. So now that I've lost my son, I would say you've got to do everything to try to not lose your child, because this is a deadly disease.
Up front. And the other thing that we learned, and reflecting back on our history and our long road, some of these symptoms of someone that's going to become an addict start to crop up before they're using drugs. And so there are also issues with anxiety and depression, other mental illness, that are the reasons why someone decides to self-medicate. And then they end up self-medicating with opiates, and then they become addicted. So it's kind of something that a parent needs to be cognizant of early on, that if their child is displaying certain patterns of behavior, that they should really see if they can get some help for them, professional help, and see if there's something going on that may lead to a much larger problem.
Could some of this be isolation and anger outbursts at family members? Could that be part of it?
Absolutely.
Anger, tremendous anger outbursts.
Yes.
And and the other piece is, I think, as we evolve in our thinking, we know addiction is a disease, and addiction needs to be treated like a disease. So, just as if you had a child who had diabetes, you would immediately take them, get them on their medication. People need to think about that in the same terms. If you see these things, there are addiction professionals. It can be treated in doctors' offices. Go for help. And there are many ways to treat it, but it's a medical treatment for this.
And it's not just counseling either.
Yeah,
we found Justin had a lot of success with the Vivitrol program, and there's other medical treatments that you can be applied in addition to psychological.
Yeah, again, I can't stress this. I say this every day to people. If you had a patient, or you had a family member who had asthma or another chronic medical condition, you wouldn't hesitate to get them their treatment. And I think we all need to evolve and to think that way.
I agree. I mean, people, we wouldn't say to them, I'm going to wait for them to hit bottom before I get them a ventilator to use over their mouth. I mean, it's crazy. And, so I don't agree with that philosophy. This is too serious a disease to wait for them to hit bottom, because bottom is very often death or something equivalent to that.
Our son had a very significant brain injury, and you would think that would be bottom for him because it changed his life, and it wasn't. It wasn't bottom. Bottom is often death, and so waiting to hit bottom, I think, is not a good philosophy. I think that it needs to be dealt with head on.
Right. I was wondering, when a young person has this problem, this serious problem, is it good to try to develop a partnership with them, like through a counselor, through a teacher, through maybe even a a probation officer or a policeman where there's a partnership where people share what's going on with this fella, you know, and talk.
Sure, it also brings in an outside objective eye many times.
Yeah.
I think the other thing is that it's a disease that not only affects the individual but affects the family. And, you know, we hear your stories like yours every day, and obviously it has an effect on everybody. So the more help that you can bring in, the better off I think you're going to be.
Yes, and I also think that the families themselves, you know, one of the things that we've found, we talk about the white elephant in the room that we're not talking about. In families, if there's an addict that's dealing with a significant issue, it affects everybody in the family and outside of the family. And a lot of times, the parents are so wrapped up in trying to deal with the wound that's bleeding, which is their son or daughter. But they neglect what's going on outside of the family. And the other siblings are often very affected in terrible ways, but they won't share it because, you know, they know mom and dad's dealing with a very big problem, so, you know, my problem's not anything, I can't worry them with this. So there's a lot of dynamic that goes on in the family when this is happening. So to your point, the family themselves really should think about family therapy or going out to groups where they can talk about this. Even Al-Anon groups, things like that, where they can get a sense of, you know, how to deal with the problem or what other people are dealing with, or just to get some things off their chest.
So are you saying there should be like an open dialogue, more of an open dialogue between all the parties?
Yes, I think that there should be. And I think that if there wasn't such a stigma attached to this, there would be more of an open dialogue. And I would like, Dr. Margolies, can you please talk a little bit about intervention and what it is and what it looks like?
So, I mean, intervention is anything that will really help change somebody's life. And it can be anything from as simple as somebody getting arrested. You know, in our world, we work a lot with criminal justice. And sometimes the biggest intervention someone has is somebody getting arrested and having the leverage of the courts actually forcing them into treatment. Or it can be people that really care about a person, showing them what it's doing to them. So, you know, anything that can be done to help somebody change what they're doing, change their lives in a positive way, should be thought of. And really, you know, an intervention would be something where you'd want to bring in all the supports you have.
How would a family go about doing an intervention?
I think, you know, we had said before, if you have a support group, that includes professionals, that's the best way. I would be a little bit hesitant to do it on your own as a family. I think you need outside support. I think that's the safest way to do it, and because it'll help mediate some of the feelings and emotions. So if you're working with a professional, or if you have a counselor, or if you don't have one, find one. There's tons of treatment programs. There's groups like Al-Anon, and I would bring in all the support that I can. They help you, and work with people who've already gone through it and done it already in many other ways.
Mm-hmm.
You know, Jim, we've been saying all along about that this is a disease. I think that, again, part of our group's mission is to bring that awareness. There's still a lot of people that are really embarrassed by this and that really don't want to get help because they think it's a bad decision, that they think someone's making a bad choice, and that's really so wrong. And so we're about cultural change in a sense. We need to change culture, change the mindset, so people don't think that way, and that maybe we can get a little bit more of this openness. People will come forward and ask for help when they need it.
Very good. Doctor, I just want to ask you a question. When it comes to treatment, are there new treatments today as opposed to 10 years ago, Doctor? Today,
I think, you know, if you look at the way addiction is being treated now, it is being treated as a disease and a medical model in many ways. So if you look at some of the newer things, there are more medications available. There's medications like buprenorphine and Vivitrol, which is blocks opiates. Buprenorphine is actually the first treatment of choice, which is a medication that blocks, it partially blocks opiates. It actually stimulates a little bit. But if you can actually stop some of the cravings and the feelings by maintaining people on medications. There's definitely the addition of mental health and psychosocial supports into addiction treatment. We've seen this, and we've been working towards this, where, you know, look at it as more than just a single disease. There's other things that it affects. There are different types of treatment facilities. There's treatment that can be done in an outpatient that typically wasn't done before. So if somebody really needs medication and really needs counseling but has a stable place to live and a family that's supportive, they can be treated in an outpatient. There's variable length of stay. People used to think that if I go away for drug treatment, I'm going to be away for 2 years. That's not necessarily true. And the other thing is that, you know, what we're seeing, what we're trying to do is bring addiction treatment into medical care. So it's not just two things that are separate. That when you go see your doctor, part of what they also will be able to do is provide treatment if you have addiction as a disease.
It's a good idea. Very good.
Absolutely.
Just want to say, Susan and Steve,
Yes.
what hope have you got for the forum in the future, and what do you plan with the forum to do?
Well, we hope we have a great outcome at this forum with Phoenix House, because we've been really advertising it. So we hope that you show up at the March 13th forum. And then we have an ongoing support group at the Mahopac Library right now, and we're in the process of setting up possibly a location called Justin's Place, which will have a support group for parents and friends dealing with alcoholics and drug addicts, and a youth support group for recovering alcoholics and drug addicts, and also a grieving group. So we're hoping we're going to be able to get that going. We're talking with different people about the location. We've got a lot of forums coming up. Go on our website. We'll have it updated by the weekend, I hope. So
we've also now starting to get to some of the schools. We did speak to the PTO at Mahopac at the middle school and the high school meeting. We've been to Putnam Valley. Those were great meetings. We got the parents involved. A lot of them came out with a lot of great questions. We told our story, and we also had some really great statistics about what's going on with our kids. You know, in terms of the surveys that the county has put out, it's alarming. You know, some of the responses to the survey. So we share that, and we're planning something with Haldane very soon as well. The PTA and the principal at Haldane High School invited us to put something together as well. Important to get to the schools, to the parents, and also to the kids. So that's been a new field, a new push that we've been successful with.
So the real thing is dialogue, right?
Communication, yeah, openness. Yes.
Not being afraid to talk about it. It's a disease, and it shouldn't be stigmatized.
Yep.
Right. Talk about things and try to keep people away from isolation. Well, listen, thank you very much for coming. I have to close the show now.
Well, thank you very much, Jim.
It was terrific.
Thank you very much for your time.
Thank you very much.
Our pleasure.
Thank you very much. Bye now.